Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On today's mini episode, the use of technology to improve oral oncolytic education, consent gathering, and treatment compliance. Since 2011, the ACCC Innovator Awards have recognized ACCC member programs, delivering cost-effective solutions to patient-centered care. This episode is part of a Cancer Buzz series highlighting the 2022 winners. Miami Cancer Institute at Baptist Health, South Florida, started a quality improvement initiative to address education and treatment compliance for patients prescribed an oral oncolytic. The result was an increase in education and consent gathering that jumped from 60% to 100%, with 90% occurring on the same day an oral oncolytic was prescribed. Morgan Nestingen is the Director of Nursing Services, Patient Intake, and Navigation at Miami Cancer Institute.
So challenges, I'm sure they're the same challenges that everybody else faces. Clinics are busy. Oncology patients are in and out. Cancer care takes place in a regular life, right? You still have to go back to work and do all of your things. So patient visits can be quite quick. You still need to have, great education, great informed consent, make sure you get the patient ready for treatment. The other thing is that this project fell into the COVID timeline, right? So patients often were virtual, and that was a new challenge for us and was difficult to capture at times.
Morgan, how did this program come about?
It came from just a review of auditing practices we had looked at before, periodically just looking at the quality of different departments and saying, how are we doing with this project? We had looked at education and consent prior, and our teams did an audit. They found that, we had some room for improvement. We knew what we wanted to do. We just wanted to improve over our baseline and really kind of tighten up. The other thing is we knew that at any given time during COVID, staff might suddenly be out. So you had a clinic that might be doing beautifully on Tuesday, and Wednesday morning somebody reported symptoms and was out sick, and all of a sudden we're understaffed in that clinic. How are we going to accommodate? Plus half the visits are virtual now, so how are you going to do that? So that was really kind of the driving force behind workforce fluctuation, changes in patient visits, but things that we knew we had to do as part of routine great cancer care.
Can you tell us how the program works and how you move that through the patient experience?
Sure. A couple of big changes that we made to this essentially were to involve on-call nursing support because we knew that any one given clinic in our building might be short-staffed at any moment. So we used additional nursing forces elsewhere on the team. We use our nurse navigators as part of our on-call team. I want to caveat that and say it's not their normal role, but they also are team players and nurses and have that competency to provide clinical education on the fly to patients. And so because of that, we use them as an assistive on-call support to be able to come in and help the other teams when needed. We gave them a portable phone that they would answer and just pop over to that clinic, meet with the patient, make sure that everything is moving along well, and then the clinic team would take over the rest of the paperwork from there. In the big scheme of things, a couple of the other major changes we did were remote consenting and education. So we would use like a telehealth platform like Zoom or Doximity or something like that and have a call with the patient, do the education over telehealth, and then provide an electronic signature option for them. And then one other thing, we used some shared document stuff. And shared technology is not that big of a deal in 2022, but adapting to using it well is. So we use daily reporting to say what new orders have been written, have we accounted for all of them, have we audited this and made sure that every single order was addressed that same day if humanly possible, and if not, that we had some follow-up reason why and how we were going to resolve that.
How is this program impacting the cancer care team? Is it improving their workflow at all?
It is. It's very helpful in a lot of clinics. And, there are times where, we've all gotten better at dealing with the pandemic world. So we don't feel that same daily struggle in terms of staffing that we did at the beginning, especially when we didn't know how long to quarantine people. So that part has improved a little bit, but we still see staffing fluctuations, right? Someone leaves their role, someone goes on maternity, this clinic has somebody who's just sick that day, like regular old normal sick. And those adaptations, the changes we made during this time period helped us adapt to those things as well. It can be really helpful in that environment when suddenly the whole clinic needs to pivot and still get the stuff done in the context of patient visits.
You alluded a little bit to the pandemic. How has this program affected your daily work life and those of your team members?
I don't know if I speak for everybody, but I'll speak for our group. We're we're tired too, right? I think everybody's a little tired. Everybody has been, doing not necessarily extra work, but different work and accommodating and flexing and living with this new reality. And the bottom line is the new normal is tiring sometimes, right? It's the little things every day, using the precautions, changing your schedule to provide on-site coverage, making sure that everybody's taken care of, making sure that you're kind of thinking of those things that were not a pre-2019 reality in the world, right? So I think there is a sense of partnership across the teams that wasn't necessarily there before. When it was on-site work, just your department, just your team, you would kind of look again around your four walls and say, these are my people right here. This is what we're going to do together today in clinic. But when you are forced to, for better or worse, branch out of that, you build some bonds that you didn't have otherwise. I know I have closer connections with the pharmacy team and the APP team and, folks in informatics who helped us build reports to do this and, trigger alerts and things like that.
You can meet Nestingen at the upcoming annual ACCC 39th National Oncology Conference. That's October 12th through the 14th in West Palm Beach. There's more information and a link to register in the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.